In this video, we're going to talk about the 10 methotrexate side effects that every older adult in the United States should understand. If you're over 60 and taking this medication for arthritis or psoriasis, you deserve clear and honest information that helps you stay safe. Methotrexate is a very effective medicine, but it affects each person differently, especially as we age. Our liver, kidneys, stomach, and immune system don't work the same way they did years ago, and that's why knowing these side effects can make a real difference in your daily comfort and long-term health. I want you to feel confident, not worried. I want you to know what to watch for, when to take action, and how small changes in timing, supplements, or monitoring can prevent bigger problems down the road. That's the purpose of today's video, to guide you, support you, and help you understand your body's signals. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Nausea and digestive discomfort. When you're on methotrexate, one of the most common side effects older adults notice is nausea and stomach discomfort. And I want you to know, this does not mean you're doing anything wrong. As we age, our stomach lining becomes more sensitive, and medications take longer to move through the body. Methotrexate can irritate the digestive system because it affects fast-dividing cells, including the cells that protect your stomach and intestines. That's why many people over 60 describe feeling queasy, losing their appetite, or having mild cramps after their weekly dose. What surprises many older adults is the timing. Research shows that nausea tends to peak anywhere from 6 to 36 hours after taking methotrexate. So if you take it in the morning or afternoon, you might start feeling uncomfortable later that day and into the next. For many seniors, switching to an evening or Friday night dose helps because it gives the weekend to recover and feel steady again by Monday. Another helpful step is the folic acid your doctor recommends. It supports your digestion and reduces this side effect significantly. Staying hydrated, eating light meals, and avoiding heavy or greasy foods around dose day can also make a noticeable difference. Remember, your comfort matters, and small adjustments can go a long way. Point 2. Mouth sores and oral ulcers. Another side effect that many older adults experience on methotrexate is mouth sores. These are not the small, minor canker sores that disappear quickly. Methotrexate can sometimes irritate the lining of the mouth because it targets fast-dividing cells, and the tissue inside your mouth renews itself very quickly. When this medication slows that renewal process, painful spots can appear on the tongue, gums, or inner cheeks. For seniors, this can be especially uncomfortable because it affects eating, drinking, and even speaking. What's important to understand is that mouth sores can sometimes be an early warning sign that your body needs better support, usually in the form of folic acid. Many older adults who develop these sores are later found to be taking too little folic acid or missing doses without realizing it. When folic acid levels are low, the mouth becomes more sensitive, and ulcers appear more easily. These sores can also be confused with infections or allergies, so make sure to tell your dentist and doctor that you're taking methotrexate. They can quickly determine the difference and guide you properly. The good news is that with the right folic acid dose, gentle mouth care, and sometimes a small medication adjustment, these sores usually heal and do not return. Your comfort matters, and you should never feel embarrassed to speak up about these symptoms. Say, next, when you're ready for point 3. Point 3. Hair thinning and hair loss. Hair thinning can be an emotional side effect for many older adults, especially women, and it's more common than people realize. Methotrexate can affect hair because it slows down fast-growing cells, and your hair follicles are among the fastest growing in the body. This doesn't mean you'll lose all your hair. Most people notice gentle thinning, extra strands in the brush, or more hair in the shower drain. But even small changes can feel upsetting, especially when you're already dealing with joint pain or chronic illness. What many seniors don't know is that methotrexate-related hair loss is usually temporary and reversible. When your doctor adjusts the dose or switches you to an injectable form, the thinning often stops and hair slowly becomes fuller again. Some dermatologists also suggest biotin supplementation, and while it doesn't work for everyone, many older adults do feel a difference. Staying consistent with folic acid may also help because it supports healthy cell growth. If you notice changes in your hair, do not ignore it and do not blame yourself. Talk to your rheumatologist. You have options, and you don't have to accept unwanted changes as just part of treatment. Your appearance, confidence, and comfort matter. The goal of your medication is to help you feel better, not take anything away from you. Point 4. Liver stress and silent liver changes. When you're taking methotrexate, your liver needs extra attention because this medication is processed directly through it. For many older adults, this can feel worrying, but the truth is, most liver changes are mild and can be caught early through simple blood tests. As we age, the liver doesn't work as quickly as it once did, and medications can stay in the body longer. That's why seniors may feel stronger effects or see small shifts in their lab results over time. These changes don't always cause symptoms, which is why they're called silent. You might feel completely normal while your liver is asking for support. The good news is that serious liver damage is rare when older adults follow proper monitoring. Regular blood work makes a huge difference. These tests help your doctor see early changes and adjust the dose before anything becomes a problem. It's also important to avoid alcohol while taking methotrexate because even small amounts can increase stress on your liver. If you have diabetes, fatty liver disease, or you're overweight, you may need more frequent check-ins, simply because these conditions add extra strain. Remember, liver health is something you and your doctor manage together. Staying informed, avoiding alcohol, and keeping up with blood tests can help you use methotrexate safely and confidently. Point 5. Bone marrow suppression and low blood counts. This next point is very important for older adults because it affects how your body stays strong and protected. Methotrexate can sometimes slow down the bone marrow, the part of your body that makes new blood cells. When this happens, your white blood cells, red blood cells, or platelets may drop lower than normal. For seniors, this can mean feeling more tired than usual, getting sick more easily, or noticing bruises that seem to appear without a clear reason. None of these signs should be ignored, because your blood cells are essential for fighting infections, carrying oxygen, and controlling bleeding. What makes this side effect tricky is that it can sometimes happen suddenly, even if your blood counts were normal before. Older adults are at higher risk because kidney function naturally declines with age, and the kidneys help clear methotrexate from the body. When the drug stays in your system too long, it can increase the chance of blood count changes. Certain medications, like some antibiotics or pain relievers, can raise this risk as well, so always check with your doctor before adding new pills. The good news is that regular blood tests catch these issues early. If your counts drop, your doctor can adjust your dose, increase your folic acid, or change how you take the medication. This side effect is manageable with close attention. Never hesitate to tell your doctor if you feel unusually weak, dizzy, or get frequent infections. Your safety always comes first. Point 6. Lung problems and methotrexate-related pneumonitis. For many older adults, breathing changes can feel especially worrying, and methotrexate can sometimes affect the lungs in a way that needs careful attention. A rare but important side effect is something called methotrexate-related pneumonitis, which is simply inflammation in the lungs. This doesn't happen to everyone, but when it does, it can make you feel short of breath, develop a dry cough, feel unusually tired, or even run a low fever. These symptoms usually come on slowly, over weeks or sometimes months, which is why many seniors mistake them for a cold, allergies, or age-related breathing changes. What makes this side effect important for older adults is that it can appear at any time, even if you've taken methotrexate for years without issues. People with a history of lung disease, diabetes, or low protein levels in their blood may be at higher risk, and age itself plays a role. The most important thing is to take new breathing symptoms seriously. If you feel more winded than usual, or if a cough lingers longer than you expect, don't brush it aside. It's better to call your doctor early than to wait and wonder. The positive news is that if pneumonitis is caught quickly, most people recover well once methotrexate is stopped. Some may need steroids to help the lungs heal faster. The key is early awareness. If something feels off with your breathing, listen to your body. Your lungs are incredibly important, and you deserve to feel safe and supported every step of the way. Point 7. Kidney function and how methotrexate stays in your body. Your kidneys play a major role in how methotrexate moves through and leaves your body. For older adults, this becomes especially important because kidney function naturally slows down with age. When the kidneys aren't clearing the medication as quickly as before, methotrexate can build up in the system, increasing the chance of side effects. This doesn't mean your kidneys are failing, it simply means they need a little more attention and support while you're on this treatment. For many seniors, this side effect shows up quietly. You may not feel pain or notice anything obvious at first. That's why regular blood tests to check creatinine levels and estimated kidney function are essential. These tests help your doctor see how well your kidneys are working and whether your dose needs adjusting. It's also important to stay hydrated, especially around dose day, because dehydration can make the kidneys work extra hard and increase the risk of toxicity. Research shows that low-dose methotrexate, the type used for arthritis, is generally safe for the kidneys and in some studies even showed less decline compared to those not taking it. But higher doses or reduced kidney function can change this picture. If your doctor ever mentions kidney numbers, don't feel alarmed, just ask questions and stay informed. Avoid mixing medications without checking first, especially certain pain relievers, as they can slow kidney clearance. Taking care of your kidneys is one of the best ways to stay safe on methotrexate. Small steps, like drinking enough water and staying on top of lab tests, make a real difference. Point 8. Skin reactions and sun sensitivity. Another side effect that older adults may notice while taking methotrexate is changes in the skin. This medication can make your skin more sensitive, especially to sunlight. Many seniors report getting sunburned more easily than before, even after spending just a short time outside. This happens because methotrexate affects the cells that help protect your skin, making it react more strongly to UV rays. You might notice redness, itching, small bumps, or a rash that doesn't look familiar. While these reactions are usually mild, they shouldn't be ignored. Your skin is your first line of defense. Older adults are more vulnerable to this side effect because the skin naturally becomes thinner and more delicate with age. Even sun exposure that used to feel harmless can suddenly cause irritation. Wearing sunscreen daily, using protective clothing, and avoiding the strong afternoon sun can help you stay comfortable and safe. If you're taking other medications, like certain antibiotics or water pills, your sensitivity can increase even more, so make sure your doctor knows everything you're using. In rare cases, a skin rash can be a sign of an allergic reaction to methotrexate or a sign that your dose is too strong. If you notice a rash that spreads quickly, comes with fever, or feels painful, contact your doctor right away. The good news is that most skin reactions are manageable with simple precautions. Keeping your skin protected will help you continue your treatment confidently and comfortably. Point 9. Methotrexate fog and extreme fatigue. Many older adults describe something they call methotrexate fog, a tired, heavy feeling that makes it hard to think clearly or stay energized. This isn't the regular kind of fatigue that improves with a nap or a cup of coffee. Methotrexate can affect the brain and energy levels because it changes how your cells use folate, a nutrient that supports energy production. As we age, our bodies have a harder time bouncing back from these changes, which makes this side effect more noticeable for seniors. You might feel unusually tired the day after your dose, or even for 2 days. Some people feel mentally slow, forgetful, or foggy, especially within the first 6 to 36 hours after taking the medication. This timing is very common, and understanding it can help you plan your week better. That's why many older adults choose to take their dose on a Friday evening, so they have the weekend to rest and feel stronger by Monday. Staying hydrated, taking your folic acid consistently, and doing light movement, like short walks or gentle stretching, can help reduce this tiredness. It may seem counterintuitive, but gentle activity often helps more than complete rest. If the fatigue feels overwhelming or lasts too long, talk to your doctor. Your dose might need adjusting, or you may benefit from switching to the injectable version. You don't have to push through it alone, your comfort matters. Point 10. Increased infection risk and immune system changes. Methotrexate works by calming down an overactive immune system, which is helpful for arthritis and psoriasis. But for older adults, this also means your immune system may not fight infections as strongly as before. This doesn't mean you will get sick all the time, it simply means you should stay aware and act quickly if something feels off. Many seniors notice they pick up colds more easily, develop chest infections like bronchitis or pneumonia, or get urinary tract infections that take longer to clear. These infections may feel a bit more intense or last longer because your immune response is quieter. The good news is that the increase in infection risk is usually modest for low-dose methotrexate, and with the right precautions, most older adults stay healthy. Keeping vaccinations up to date, like the yearly flu shot and any pneumonia vaccines your doctor recommends, helps protect you. Washing your hands regularly, avoiding close contact with people who are sick, and paying attention to slow-healing cuts or sores can also make a big difference. If you start feeling sick, especially with fever, shortness of breath, burning while urinating, or a cough that won't go away, don't wait it out. Call your doctor early. Older adults can escalate faster, and quick treatment can prevent complications. Methotrexate should support your life, not interrupt it, and being proactive with infections ensures you stay safe and strong. As we come to the end of this guide, I want you to remember one important message: you have far more control over your health than you may realize. Methotrexate can be a life-changing medication for older adults living with arthritis or psoriasis, but like any powerful treatment, it requires awareness, monitoring, and good communication with your doctor. Understanding these side effects does not mean you should fear the medication. Instead, it gives you the tools to protect yourself, catch problems early, and stay comfortable while benefiting from the treatment. Most seniors do very well on methotrexate when they take folic acid consistently, keep up with blood tests, stay hydrated, avoid alcohol, and speak up about any new symptoms. You should never struggle in silence or assume discomfort is just part of aging. Your body deserves respect, your concerns deserve attention, and your treatment should support, not limit, your daily life. If something doesn't feel right, call your doctor. You never have to figure it out alone. Your health journey is a partnership between you and your healthcare team. Your experiences, your energy levels, your symptoms, they all matter. By staying informed and listening to your body, you can use methotrexate safely and confidently. You deserve comfort, clarity, and the best quality of life possible, and staying aware is one of the strongest steps you can take toward that.